Hello, everybody. My name is Patricia Hickey, and I am the Vice President of Cardiovascular and Critical Care Services at Boston Children's Hospital. I'm thrilled to welcome you to this OPENPediatrics Nursing World Shared Practice Forum on our institution's experience with the American Association of Critical Care Nurses standards for establishing and sustaining a healthy work environment. The American Association of Critical Care Nurses launched the Healthy Work Environment Assessment Tool in November of 2009. It is an electronic quantitative assessment that is based on the 6 evidence-based standards and provides a framework with an aggregate score of the 6 standards, and then individual scores for 3 items within each of the 6 standards. So here at Boston Children's Hospital, we embraced this framework and assessment tool to guide our strategy to support staff. I would say that we were early adopters in 2010 when we began annual assessments across all cardiovascular and critical care areas of the hospital. As the healthy work environment is so closely tied with optimal patient outcomes and clinical excellence, our approach has always been to find the good within the environment, and this assessment gives us an ideal opportunity to do just that. So I'm joined today by 4 esteemed colleagues who use this approach to contribute to optimizing the health of the work environment in their units across Boston Children's Hospital. I'd like to welcome Dennis Doherty, who is our professional development specialist within clinical education, informatics, and practice and quality. And Dr. Kara Ledger is the nurse manager of one of our inpatient surgical units. And Dr. Jason Thornton is the director of nursing patient services for our cardiac operating room and intensive care unit. Dr. Jean Connor is Director of Nursing Research for our cardiovascular and critical care programs as well. I'd like to begin with a question for Dennis. So when you started your work on the health of the work environment, you were a staff nurse in our medical surgical intensive care unit, and you used a mixed methods approach to your research. What prompted you to use this methodology?
We always had a group that looked at recruitment and retention issues in our unit. And when we learned about the AACN Healthy Work Environment assessment tool, we were really excited that this was something that we could use almost to help legitimize our work that we were doing around recruitment and retention. And so we did a 2-phased approach. Our first phase was actually administering the Healthy Work Environment Assessment tool to our interprofessional staff. And that was a great way to sort of, I say, take the temperature of the health of our work environment. But it was really I think the second phase of our initiative where we took a deeper dive to learn exactly what does each score from the assessment mean to our group. What does a 3.5 in skill communication mean? And I think that in order to better understand what our staff were thinking and how they viewed each of the standards and what their scores really meant, it was important to take a deeper dive. And so when we were able to learn from our staff what a 3.5 in meaningful recognition means to them, that was really powerful. So we held focus groups, and we invited our interprofessional staff to come together and talk about the health of the work environment using the actual scores from our assessment as like a starting point for those discussions. And that was really an interesting way to learn really what the staff felt.
So when you were able to review your data, you learned that the health of the work environment in the medical surgical intensive care unit was strongly in the good zone. Most of the scores were 3 to 4. How did that affect your conversations with the staff, and what did they tell you that meant to them?
The findings of our focus groups, they challenged the assumptions that I think many of us had on our recruitment and retention committee. you think you have a sense of what the standard means to staff, but the themes that came up in our focus groups sort of really opened up our eyes to the reality of how staff viewed things. There were several themes that frequently came out in our focus groups. Majority of them were related to behaviors around the standards of skilled communication, appropriate staffing, and meaningful recognition. And interestingly, the actual aggregate scores for each of those standards when we did the assessment were the lowest. And so through the discussions in our focus groups, we learned that nurses felt that the one-on-one communication between staff might be an opportunity for improvement. Communication from our leadership, specifically email communication, was sort of viewed as not as balanced between positive and negative. When we talked about meaningful recognition, this was really an area that was interesting because even personally, I had a view of what meaningful recognition meant to me. But as you heard and read transcripts of nurses talking about what meaningful recognition means to them, you can really see that it was really personal. One of the things that came out was that staff really valued paid time off, and they would link this idea of having paid time off to being meaningfully recognized for the work that they're doing when they're at work. Participants stated that staffing, when we talk about appropriate staffing, that staffing difficulties due to an increased patient acuity, increased patient throughput and capacity challenges. And it resonated with us participants when it came to talking about appropriate staffing. That said, it was telling in the focus groups that participants were able to look beyond their perspective at the bedside and almost have an appreciation for the challenges that their unit leadership were faced when it came to staffing based on multiple internal and external forces.
So what a wonderful way to quantify the scores and link those to the rich qualitative data and discussions that you had with the staff. So I'm sure they felt very involved and part of the solution. What were you able to do with the information that you heard and the quantitative findings to improve? Do you have a couple of examples of that?
So I think first and foremost, which is really important, is that the staff, they learned what the scores were. So they got the results. We disseminated the results to our medical surgical intensive care unit council on recruitment and retention. And what we did from there was we used the 6 standards to form smaller working groups within our committee. And they went and had conversations and discussions with staff to sort of to share what what was learned in the focus groups, and then to generate some solutions or ideas about how could we target a certain initiative, how could we target meaningful recognition on our unit, and then from there, when we came up with a pretty exhaustive list of sort of ideas, everything from thinking really big to smaller ideas, we members of the group collaborated with our leader to go through the list and sort of think about what was practical interventions that we could put into place that might impact the health of our work environment the next time around that we're doing this assessment. The leadership agreed that there were clear opportunities to improve communication, particularly email communication, and they piloted some different forms of communicating cohort and communication into a weekly newsletter, using different technology that involved video instead of what was typically done was just email communication and email communication. And it's important that it was important that they verbalized a commitment to try to balance the positive and the negative, which came out in the focus groups as an imbalance in our communication. And then in response to feedback on the variability of formal hospital recognition programs, the group came up with an idea to really promote what what was available for staff to recognize each other. There's so many opportunities to recognize staff from a unit level, from a hospital, through formal programs. And so they did education and outreach to staff to make sure everyone knows that these are opportunities that you can use to recognize your colleagues. And then the concept of time off or paid time off as meaningful recognition was it resonated with the staff and with our leaders. And our leadership committed to providing equitable opportunity to have time off, particularly around the summer months, because that's where staff focused that they work so hard all year, and then in the summer is where we want to have a break. And so there was efforts made to be flexible with hours to allow our staff to use their earned time in summer months.
So that's incredible work, Dennis. You really formalized the anecdotes and the experience of what you heard from staff with the quantitative data. I would like to stop here and take a moment to pose a question to our audience. Please leave your city and country location. Does your unit or hospital use a tool to assess the health of the work environment? If so, which tool does it use? So, Kara, you replicated these methods in 3 surgical inpatient units, I believe. And you focus specifically on understanding recognition, meaningful recognition in the surgical inpatient unit. Can you share with us some of the strategies that you were able to implement in this work?
Overall, I believe the whole standard doesn't get as much attention as it should. In 2015, the 3 inpatient surgical unit participated in the hospital-wide Healthy Work Environment Assessment, and our score was good to excellent range. However, this was an opportunity to improve in meaningful recognition. And looking at the literature, meaningful recognition was the least investigated of the 6 standard. We saw this as an opportunity to take a deeper dive into this one standard. Similar to Dennis' work, we utilize focus group to better understand our staff perception of this standard. Additionally, we asked participants to complete the 3 healthy work environment questions for meaningful recognition. We were fortunate enough to have Dennis to help facilitate our focus group, giving his commitment and history with the healthy work.
And what did you learn from Dennis's focus groups?
We were able to conduct 6 focus groups with 22 participants across the 3 inpatient surgical units, and we had 3 themes. The first theme, that it was a fine line in determining who and what is worthy of meaningful recognition. The second one, meaningful recognition matters. And our last theme, it's personal. We recognize the difference in nursing activity that were worthy of recognition. One participant said, it's no longer meaningful if it's for the things that we're supposed to do, while another said, we should receive meaningful recognition when a staff goes above and beyond the standard of practice. Participants really appreciated and value when leaders advocate for policies that supported their workflow. Receiving compliments from leaders boosts confidence and morale. One participant stated, I find it nice when people in higher position than me comment on my work. They also appreciate meaningful recognition from patients, families, and also their peers. As one nurse stated, getting recognized by a peer makes you feel as part of an integrated team members. We saw the difference in the type of recognition that participants valued. Some felt a simple thank you was sufficient, while others felt appreciated really the formal recognition program that we have in the hospital. With the third theme, it's personal, meaningful recognition was deemed to be subjective and often defined by the unit culture. Broad variability in meaningful recognition was noted across the 3 units. Each unit had its own belief and culture. Nurses identify how important it is for them to have a role in determining their unit's meaningful recognition intervention. Participants also recognize managers and leaders may not always be aware of a nurse who goes above and beyond unless a peer or a patient recognize that individual.
So what you have described is exactly why there is so much opportunity in the meaningful recognition standard. There's also seemingly a gap in the literature, and I wonder if it's about the multigenerational workforce and how at different ages and stages, what is meaningful to each of us is different. Can you tell us how your results from the work that you did, qualitatively as well as the quantitative results from the survey, align together?
In looking at the healthy work environment results for participants, the overall assessment of meaningful recognition was, in their culture, it was good, 3.83. However, in looking at the specific results, the subjectivity of the standard was confirmed. Particularly as we look at the result of the question to administrators, physicians, nurse managers, nurses, or other members speak up to let people know when they're doing a good job. We saw 39% of the participants answered neutral. We also saw a wide variation in the response to the questions. There are motivating opportunities for personal growth, development, and advancement. We believe this wide variation reflects the subjectivity of individual perception of meaningful recognition and what it means to them. You mentioned meaningful recognition with the generation. I can say that some of the experienced nurses didn't feel the exemplar were publicized as much. So what I've done is to incorporate exemplar reading during our regular staff meeting throughout the whole year and selectively choosing between staff nurse 2 and staff nurse 1. And also the scholarship that the hospital has provided allowed several of my experienced nurses to return back to school to obtain a master's degree. I think we're doing a great work.
So what are your plans now and what are you intending to do to move forward?
Based on the results, we concentrated in our efforts in increasing leadership visibility within our units. We also increased our utilization of hospital-wide formal recognition program by implementing a standard and a process for peer to recognize each other. To further disseminate the peer recognition, we highlight Way to Shine during unit-based staff meeting. In addition, we recognize the recipient of the award, and we also take an opportunity to highlight the nurse who submitted the recognition.
Kara, I'd like to commend you. Your work is amazing, and you really were able to highlight the effectiveness of the Healthy Work Environment Survey outside of critical care units. So thank you. Now, Jason, I'd like to turn to you because you have done amazing work in the pediatric cardiac operating room at Boston Children's Hospital. There was a point of time when we received results that were not optimal. And because of an interdisciplinary commitment and your leadership, we were able to make real investments in the work and had pretty important results. So why don't you tell us about that?
Thank you, Patty. After several years of our annual assessment, we identified a recent trend and clear opportunity for some focused improvement. We convened, as you said, an interdisciplinary working group with representation across the cardiovascular operating room to serve as healthy work environment ambassadors. Together, we developed and prioritized targeted initiatives through interdisciplinary brainstorming sessions with the entire CVOR team. Through this work, we were able to see a dramatic improvement in our scores and a true transformation in the health of the work environment.
excellent example of the use of the Healthy Work Environment Assessment. I also know that you have taken this to the next level, this work, and have committed to a national understanding in pediatric cardiac operating rooms of the health of the work environment, which is going really well. Why don't you tell us about your national work with the Healthy Work Environment Survey across pediatric cardiac operating rooms?
Pediatric cardiac surgery is complex and risky, relying on strong interprofessional teamwork for optimal outcomes and avoiding patient harm. To support this development of targeted interventions to improve the health of this very unique work environment, the first step was really to understand the health of the work environment in pediatric CVORs. At the time, there was no national benchmarking available for specialty areas, and results are not publicly available for comparison. So a 3.2 in one environment doesn't necessarily relate to a 3.2 in another environment. So a benchmark for pediatric CVORs enables these units, these really specialized areas, to understand the relative health of their work environment and support collaborative improvement efforts by identifying specific areas for targeted improvement.
So, in a structured way, how did you go about this study in examining the health of the work environment nationally?
I utilized the Consortium for Congenital Cardiac Care Measurement of Nursing Practice, also known as the C4MNP. C4MNP is a nationwide collaborative of 41 pediatric cardiovascular programs in the United States whose primary aim is to identify nursing care actions and behaviors so that we can measure them in this highly complex pediatric cardiovascular patient environment. To assess the health of the work environment in pediatric CVORs, we utilized AACN's Healthy Work Environment Assessment tool.
And what did you find?
Excitingly, we received results representing 11 pediatric CVORs across the United States with 183 respondents, which equated to a response rate of 60%. Each discipline within the cardiac OR was represented, including nurses, surgeons, physician's assistants, respiratory therapists, surgical scrub technologists, and anesthesiologists. The participants included clinicians with varying amounts of experience within their own pediatric CVOR. The overall mean healthy work environment score was 3.49, with a pretty wide range between 2.65 to 4.34. Overall, the mean scores for each standard were within the good range. Participants reported the highest scores for the effective decision-making standard and the lowest scores for the meaningful recognition standard. After reviewing the results with the participating sites, all of the sites together, we proposed a national benchmark score of 3.50.
This is such awesome work, and you should be so proud that you had a 60% response rate on a first-time ever examination of the health of the work environment across these centers. Really well done. And what do we plan to do with the findings in an actionable way?
Each site is using their specific results to identify areas of focus for targeted interventions to improve the health of their work environment. I am working directly with some of the participating sites to identify more of these targeted initiatives to help them through the process. Additionally, we plan to reconvene with those leaders from across all of the participating sites to support really collective and collaborative improvement efforts that we can standardize across the United States.
Each of you should be commended for these exemplary presentations of how you have individualized the standards on each of these units to a pathway for improvement. Let's stop again now to ask the audience another question. Please leave your city and country location. Has your institution committed to improving the health of the work environment? And if so, what steps has it taken to create a healthier work environment? And now I'd like to turn to Dr. Jean Connor. And Jean, I'd like you to give us some background to understand what led you to validating the interprofessional use of the healthy work environment assessment?
Yes, thank you. So I think when we first started really having the ability to quantify the results of our work environments, this was a novel step for us. And so as a nurse scientist working in cardiovascular critical care, it really gave me the opportunity to examine the measure itself, and looking what AACN had done to, as a first step, develop the tool, and their early steps in really validating the tool. Now, interestingly, AACN put forward the framework as an interprofessional model. The questions from the assessment tool were also interprofessional based. But their first steps at validating the assessment tool were really with a cohort of critical care nurses. And so while we, in our cardiovascular and critical care programs, evaluated the health of the work environment starting in 2010, we always approached it with that interprofessional approach. So in looking at how the tool was initially validated, I think, Dennis, you and I actually reached out to the developers and AACN, started that discussion, and they were very enthusiastic at any opportunity to extend that early validation. And we're able to administer across the organization, not only our main campus, but also our satellite campus, and really invite the whole healthcare team. While nursing was the greatest proportion of respondents, we were able to get physician, respiratory, social work, our administrative workforce. So this was an opportunity that we saw not only to understand our results within our own programs, but across the team.
So given that, what were the methods that were used to validate this assessment as an organizational measure?
Right. So we also wanted to further understand the validity of the tool. Ongoing assessment also at Boston Children's Hospital included the AHRQ culture of safety survey. This was another important way our organization understood the quality and the safety of our care as experienced by our staff. So this validated tool was an annual assessment since 2010. So again, we had a way that we could contrast what we were seeing with the AACN Healthy Work Environment tool, as well as this culture of safety. So that was an important step, given that similar to how we were thinking about this interprofessional, the AHRQ Culture of Safety survey was an interprofessional survey. So that was a perfect match for us.
And what did you find?
So we were thrilled as a first step to have a close to a 40% response rate. Again, a strong marker that we were able then to really understand the results from the staff directly. So that 40% was about just over 1,000 respondents. As we wanted to understand the reliability and validity, we actually wanted to see what were the results. So just where do we rate as an organization? Similar to what we had found in our cardiovascular and critical care over just about a decade, the organization-wide results were 3.58. And if we think about that scale of 0 to 5, 2.99 to 4 is good. So we were good as an organization. Another important part of this was to understand across the disciplines, we're both perceiving the work environment in a similar way. And while we did see an increase in the physicians being slightly higher, nurses were also rating in the same direction, meaning that both were trending in the same way. So this was an important validation step so that when we really included the whole team, we were able to say the whole team is seeing things similar. So that was an important interprofessional validation. But back to the reliability and validity. the reliability we carried out in a two-step way. We did the first step of reliability conducting test-retest. So we had that initial cohort of over 1,000 participants complete the survey, and then we invited a 10% sample to, again, take the survey, and then we were able to compare the results, the reliability that we would end up getting a similar response given the first taking and the second. The other step that we were able to calculate was the internal consistency. This is also important to establish that is it measuring as best possible free from error? And so an acceptable level is 0.7 or greater, and I think ours was about 0.77. So we were able to say reliability was acceptable and strong in both those exercises. Our convergent validity, so that ability to correlate, compare between the healthy work environment assessment tool and the culture of safety. So this was exciting for us because we were able to correlate strongly, good to strong, in many of the key components of communication, of teamwork, of recognition. And so with that in mind, I think our ranges were 0.30 for the correlation to 0.52. So again, good to strong. So based on these results, we were able to conclude that this was a reliable and valid measure, and that it was a measure that performed in a similar manner across the institution. So this was our first opportunity to see across the institution, but also across disciplines. We were able to really stratify that physician and nurse and really inform not only our staff, but also our leadership as to how this performed across the discipline.
And how should we apply these findings?
The health of the work environment is multidimensional, and that it really requires all 6 standards. So all 6 have to be recognized and working together. Each of these standards requires ongoing attention. And what we, and I think, Patty, you have always said this, is that all are accountable. Right? So not just the nurses, not just the physicians, but it's all that work in these clinical areas, taking care of patients and families, are accountable to that work environment. And as such, it's critical to have a reliable and valid tool. So with that in mind, we believe that this is a tool that we can use in an ongoing fashion, that it's generalizable beyond the critical care setting as it was originally imagined, and also useful and valid across the interprofessional team.
Another thing that we know about staff response to this survey in particular is that they truly love it and find it valuable. It is short and meaningful for them. We have experienced that across cardiovascular critical care and our general inpatient units and ambulatory units. And that is one of the most compelling reasons to use this evidence-based assessment to inform staff and improve the health of our work environments. So I'd like to know how we can help other institutions and what our next steps would be to help colleagues across the country and beyond to inform the health of the work environment so that they too can use this assessment to improve their environments.
And I think similar to how we learned, Patty, really accessing the AACN website. The AACN has updated their white paper as recently as 2016. It provides a beautiful detail and roadmap and a real understanding of each of the standards and how the healthy work environment assessment tool works. And then I think after educating, as leaders and then their staff, really engage in the web-based tool that AACN provides. It's free and really supports the summary of the results and the reporting back so that leader can then use that and share that with staff. So I think our journey, and it continues to be our journey, But the first step was really just educating ourselves, and all of that rich information is available on the AACN website.
And a strategy that has worked well for us is identifying unit-based healthy work environment ambassadors and empowering them to educate the staff on the health of the work environment, including the importance of a healthy work environment, the actual AACN framework, and the assessment tool. These ambassadors really are central to the development and implementation of the targeted initiatives.
I want to take this opportunity to again thank my esteemed colleagues. It has just been wonderful hearing the results of the work and reflections on this journey. And I'm thrilled to be able to share our experience at Boston Children's Hospital over the last 10 years with our colleagues across the world, because we all know that whatever we can do to improve staff satisfaction and the health of the work environment for our staff will also ultimately advantage patients and families. Thank you.